Hello, I'm Joe. How are you doing today?
Hi, Joe. My name is Miss Dracula. What kind of service do you have here today?
We're the San Diego American Indian Health Center. We offer dental, medical, behavioral health, and youth and family services. Please have you sign in.
Sure. Yeah, we just moved here from Pennsylvania from the rest. My husband has a toothache. Do you have any services?
How long have you had the toothache?
Oh, for a couple centuries. He's a vampire.
Interesting. Okay. Well, if I can get you information on this referral sheet right here. Have the dental department give you a call next week, and we'll get your husband in to see Dr. Richardson.
Awesome. Thank you.
Yeah.
Good afternoon.
Good afternoon. How can I help you?
My name is Dracula.
How can I help you,
I have
Mr.
a terrible toothache.
It's been a long time since you had this toothache?
Yes,
Yes. Okay. Dr. Richardson will help you in a few minutes.
many centuries.
You need a what?
Many centuries.
Centuries with your pain. Well, Dr. Richardson's going to be with you in a few minutes, but I need this forms, please.
Forms.
Yes.
Okay.
Thank you.
Ready? Mr. Dracula, can you come back, please?
Yes.
San Diego American How can I help you?
Good morning, Mr. V.
Yes, hello.
Hi, I'm Dr. Richardson.
Oh,
Nice to
pleased
meet you.
Oh, let me look at your neck for now. Very good.
So, what brings you in today?
I have a terrible toothache.
Oh, really? How long has it been bothering
Oh, centuries.
you? Okay, and is it sensitive to anything in particular?
Yes.
Like hot or cold things?
Hot and cold.
Okay, fantastic. Let me take a quick look and we'll figure out what we're going to do, okay? So go ahead and open for me. Open really wide. Thank you. Okay, well what we're going to do is we're going to get an x-ray and take a quick blood pressure on you, okay? Does that sound all right?
Okay.
Okay, thank you. Just be a few minutes, I'll get my assistant in.
Very good.
Thank you. Well, Mr. V, it looks like you're going to need a root canal and a crown. Unfortunately, your blood pressure was a little bit too high today for us to give you any treatment. Are you feeling a little bit nervous?
I'm very nervous.
Okay. You don't like the dentist?
Oh, not at all.
Okay. Well, I'll tell you what. When you come back, what we can do is give you some nitrous oxide or laughing gas, and that'll help with the anxiety. But for today, I can give you some pain medication and an antibiotic to fix your tooth. What we'll need to do, though, is to send you over to our medical department where they can evaluate your blood pressure and stabilize it before we actually do any treatment on you. Does that sound okay?
That sounds okay, but I need help today.
Well, I can give you the pain medication and an antibiotic to get it controlled. One more thing. How long has this tooth been bothering you again?
Centuries.
Okay. Dr. Cabrera!
Hello,
Hi.
hello, nice to see you, Dr. Richardson.
Nice to see you too. This is Mr. Dracula.
Nice to meet you. I've heard all about you.
We are having a little bit of a concern with his blood pressure, and I was hoping you could check it out for him today.
Yes, it's be no problem for us to take care of you here today. So thanks, Dr. Richardson.
Thank
I'll take
you.
them from here. So welcome to the clinic, and I understand you've already completed all your paperwork. The dental department says you were having a little problem with your blood pressure. I also saw in your paperwork that you have this kind of insatiable desire for blood.
Oh, my favorite.
These are very unusual symptoms, and I believe that we can get down to the bottom of it. We may need, kind of in a funny way, we're going to need to do some laboratory tests, and that means we're going to have to draw blood from you for a change. In the medical department, we are able to provide for sampling of different kinds of lab tests. And so it is a convenience that we provide for our patients so that they don't have to leave the site to go and be able to get some laboratory tests done. My concern, though, is also that some of these symptoms that you have, I believe, might be important to follow through with our behavioral health department. Many times, patients come in to see us with concerns that are due to stress, anxiety, post-traumatic stress disorder or other behavioral health type conditions. So I was hoping that you might be available to be able to meet with our behavioral health therapist and be able to meet with her, talk about maybe some of the issues that might be also playing a role in some of the symptoms that you're having.
Maybe that would work because I have very difficult time sleeping during the day.
Well, this is obviously a big concern, and many different factors can come into play. So if you don't mind, I'll go and I'll get our behavioral health specialist to come and help you today.
Well, it's nice to meet you, Mr. Dracula.
Same here. I'm very pleased to meet you.
I was talking with Dr. C for a minute, and he had some concerns, you know, and just wanted me to meet you. And I was wondering if you'd catch me up a little bit. He talked about you having some anxiety and
I have an addiction to blood.
Oh.
I drink blood too much.
Oh.
I need to cut back.
Okay. So is this addiction been going on for a while?
Quite a few centuries.
Okay. And you're feeling that this is something you'd like some help with?
Yes.
Okay. Well, good. I think that's, you know, we can certainly do something with that with you. Okay.
I'm not really sure about the behavioral health services.
Well, you know, a lot of people feel that way, but I'm really glad you came in because I think it takes a lot of courage to come in and, you know, and talk about problems. If you're comfortable, we could talk more about it outside of the medical department. We could spend more time because I think it might be helpful to kind of look into this and how this conflict started. And I mean, it sounds very important to you. Important to figure out. Was there something else Dr. C had mentioned you were interested in, or?
Well, you see, I have I just recently adopted a 13-year-old little vampire.
Oh, okay. Well, congratulations.
I'm looking for something for this little youth to do. Do you have any kind of programs for the youth?
Well, as a matter of fact, we do. We have a youth center, and we're open to anyone. We're very diverse. We do focus on Native American culture, but we're open to, like I said, everyone. We have a wonderful program, lots of arts and crafts and activities, and it's really going very well, and it might be a way you can meet other youth. If you'd like to, I could take you across the street and show you our youth center.
I would love to do that.
Okay, great.
What a wonderful clinic this is.
Okay, well, thank you. Why don't we go do that? Hello, come on in. Hi, Daniel.
Oh,
I think
hi, Naomi.
possibly have a new youth for you. This is Mr. Dracula and his son,
Hello.
Dracula Jr.
Hi.
And
How are you doing?
we were just over in medical, and Mr. Dracula had mentioned that they just moved here from the Transylvania Res,
Okay.
and that his son might be interested in meeting some youth, and I thought about you, and I was hoping you could let them know about the youth center.
Okay, well, welcome,
You're
first
good
of all.
hands.
There's
Thank
wonderful things over there.
Did you?
Mm-hmm.
Okay.
And I wanted to bring my son over here. We just came from the Transylvania reservation. Thank you.
Glad that you guys are here. Hope San Diego's been good to you guys. The youth program is open to youth ages 9 through 22, so how old are you?
I'm 16.
Oh, look at that. We have special programming for youth siblings who are ages 6 through 8. So all we have to do is get your dad here to fill out paperwork. Everything is totally free here at the youth center. We have tutoring, we have a computer lab, we offer nutrition, physical fitness, and health classes, as well as free counseling and therapy and that kind of thing if you should feel like you want to talk to somebody. I'm the youth center therapist, so anything I can do for you guys.
Perfect.
Okay. Cool.